The Honorable M.E. Sukers.
Thank you, Honorable Chairperson. Chair, it is important for us to note that we are less than 8 months away from an election. This is not the time to sign binding agreements. There will be a new government in 2024, and this ANC government will be seated in the opposition benches next year, if the will of the people of the country translates into votes. In principle, we can all support the goals as stipulated in the AMA document of improving access to quality, safe and effective medical products, and joint partnerships, streamlining of systems and upscaling of efforts to improve access are all instruments of improvement, if all things remain equal as stipulated in the treaty. But we are in no position to ratify this treaty today. This Parliament is being asked to ratify this treaty blindly when it comes to cost. We have learned very expensive lessons under COVID, and one of the outstanding ones is that the principles of democracy can be ignored by confidentiality agreements. Chairperson, we live in a period where the public trust in governments around the world is at an all-time low because of that. As a responsible Parliament and responsible public representatives, we must request that cost implications, terms of reference are presented to the committee before we ratify this treaty. Practices of good governance and stewardship demands that we do. The ACDP does not support this ratification that would bind us to terms and costs that we have not fully calculated or considered. Thank you.
Thank you very much, Honorable Member.